Hey everyone, I just wanted to make a quick video about the approval process that I went through before scheduling surgery. I have Anthem Blue Cross. I work and live in Washington State, although my employer's in California, so I have the Anthem available through that employer. Um, in order to be, I'm sorry, I'm reading off my list again. In order to get approved for surgery, I was required to go through some blood work and just kind of physical exam type testing. I did have an EKG, also to just make sure my heart is functioning properly. I also met with a nutritionist. My particular plan did not have any requirements regarding seeing a nutrition specialist for like a long period of time. I know some plans require 3 months of monitored care with a nutritionist or 6 months. Mine actually did not have that requirement. So I've met with her a couple of times through a weight loss support group that I'm attending that she also helps manage at the bariatric surgery center where I am going for treatment. And I've also seen her privately, but I don't have to have ongoing appointments over a long period of time prior to my approval through my insurance. That wasn't a requirement. I also saw a psychologist and did a couple hours of testing. It was similar to taking an SAT test. There were about 600 questions I answered, all fill in the bubble, and we also had a chat. We probably spoke for 45 minutes or an hour before I went ahead and started the actual test portion of the interview. Past that as well. I was pretty nervous about that, but it was actually really nice to talk to someone about it who was just totally unrelated to the situation. He was very positive about my decision, very encouraging, and he was impressed with the amount of research and knowledge that I have about the procedure that I've chosen, the gastric sleeve or vertical sleeve gastrectomy. So that actually felt pretty good. I also was required to see a pulmonary specialist, so I had to go up to a large hospital kind of away from my home to do that with in a pulmonology department at the hospital where I will be having surgery in September. And they just wanted to ensure that my asthma is under control, that I wouldn't have any complications during surgery because of the asthma. And they also supported the surgery choice of gastric sleeve and did not anticipate any problems whatsoever related to my asthma or my lung capacity. So that was really great news. So basically, I went through a series of appointments. I let my doctor know, my primary care doctor know that I wanted to pursue bariatric surgery. I'd already been doing research for several months and had discussed it with her and a couple other previous doctors over the years. But I let her know, so she referred me to a bariatric surgeon. I then scheduled a consultation with his assistant, who is also a physician, went through that process with her, then scheduled my nutrition, my pulmonary appointment, and my appointment with the psychologist. So I scheduled all those appointments at my appointment with the physician's assistant and just worked through those over the last 2 months or so. They were fairly spread out just because those providers that were covered by my insurance and that work in tandem with my surgeon's office were pretty busy. But once I got through those appointments, my bariatric surgery liaison or coordinator, her name is Stephanie, she submitted very quickly. I shot them an email and let them know that I'd also completed some online courses, a couple hours in courses that the surgeon had requests that all of his patients review. And pretty immediately she submitted my case to insurance for approval. And that approval came very quickly. I got a letter saying that it could take up to 14 days for my insurance to respond. And I had some warnings from friends who'd been through the process that sometimes they decline the first time and resubmit with the same information and they end up approving. So I was a little concerned that I might not get a positive answer immediately or that there'd be some delay. And I was very pleasantly surprised. I got a phone call just 2 days ago on Monday, July 21st from Stephanie to let me know that Anthem, my insurance company, had already responded and provided approval for surgery. And then over the last couple of days, I've also heard from Anthem. They have a nurse coordinator who just wanted to make sure that I knew she was available if I had any questions. I also did a little survey with them. They wanted to make sure that I had support through the surgical process, like the actual, like going to the hospital and coming home from the hospital, and aftercare. So that was actually a pretty nice response from my insurance company, something that I don't normally expect from insurance. So I got the approval on Monday. I called Stephanie back. I discussed it with my partner, and the September date is the one that works best for us. They gave me 3 dates to pick for, one in August, one in September, and one in October. I do have some prior engagements or just things on the calendar in August and September prior to the September 30th surgery date that I really felt strongly about, being able to take part in those events. So we are pushing it to September so that I don't have to worry about trying to get healed enough in just a few weeks to be part of those events. And I didn't want to push it out to October unless I absolutely have to, because I'm pretty excited to get this going and start really losing some weight and getting active again. So I've chosen the September 30th date. I am just waiting. Stephanie's gonna check with the surgeon. She says she always double checks just to make sure that the surgeon doesn't have any questions about that date or any any problem with the date that I picked. So she said she'll get back to me by the end of this week or early next week just to confirm that surgery date with me. But I'm expecting that surgery will happen on September 30th, 2014. I'm going through a bariatric surgeon in Seattle who has a very, just a great track record with bariatric surgery. His rate of mortality is actually even lower than the national rate, pretty substantially lower. And this is all that he does, is bariatric surgery. And his team is very well oiled and coordinated. I felt supported and informed just along the whole way. Really knew where I was in the process and what to expect next. So that was the pre-approval process for me. Approved on Monday, just a few business days after my file was submitted. So I hope everyone else's approval goes as easily as mine did. I know some of you watching other folks' videos have definitely had struggles with approval. And that's really that's just very sad to hear, and I'm sorry that you went through those troubles. I have been extremely lucky so far with this process for myself, and I'm just feeling very thankful to have the support of a really great medical team. I feel very confident about them, and also the support of my partner, who's just amazing, and he's just amazing. So that's it for now on my pre-approval process. I have some other videos written down, a list here. So I'm going to be talking about 10 things I won't miss about being fat, and also some non-scale victories, or NSVs, that I'll be looking forward to in the months to come. So hope you're having a great day. I will talk to you soon. Okay, bye.